of the reopening. And we did this because we understood that these mitigation efforts were done and undertaken to flatten the curve and to prevent our hospitals from being overwhelmed. And if you remember, in mid-March, there were news reports projecting up to 464,000 Floridians could end up hospitalized due to the coronavirus. We only have 70,000 hospital beds, so that was a terrifying prospect. It would have left hundreds of thousands of people without medical care. Fortunately, that parade of horribles has not come to pass. On April 24th, which is the date projected, we had about 2,000 people hospitalized in the state of Florida. Again, we don't like to see anyone there, but clearly those doomsday predictions were not realized. Our hospitals actually had more capacity 6 weeks into the pandemic than they did before the pandemic began. So we understood that we have a responsibility to move forward in a safe, smart, and step-by-step approach. This would be an approach that would be rooted in facts, not in fear. It would be based on our observed experience, not based on hysteria, and it would require a sober analysis of data, not panic-inducing clickbait headlines. Now, this announcement, as many people here in South Florida understand, applied to 64 of the 67 counties, all our counties in Florida except for Miami-Dade, Broward, and Palm Beach counties. And the reason we did that was because from the very beginning of this, we have consulted and worked collaboratively with the counties, all three of them, every step of the way. It was their view and in my view that although the trends had improved since late March and early April, that they needed a little bit more time to prepare. And so I was happy to work with them on that. And I said, prepare, develop a plan. When you guys are ready, come to me and let's move forward together. And then that's what we're prepared to do today. But the 64 counties represent 16 million Floridians, and those counties have been doing very well also. We are monitoring the data on a daily basis, but since we went to phase one of the reopening, the percentage of positive tests throughout the state has ranged between 1.84% and 5.27% for new cases, averaging about 3.5% for all new test takers. For the phase one counties, the average was about 2.5% positive. And so that was a really good sign to see that continue as we've moved into phase one. Total COVID positive individuals throughout the state of Florida in the ICU since we undertook phase one has decreased by 21% since the night of May 3rd. There were 600 individuals in the ICU at that time. As of last night, there were 472. Also, total COVID positive individuals on ventilators has decreased statewide in the last 2 weeks by roughly 32%. At that time, there were 340 people on ventilators prior to us starting phase one. There are now 232 as of last night. The syndromatic indicators in terms of hospital admissions based on symptoms like coughing remain low. Influenza-like activity remain very low. And so those 64 counties, the original phase one counties, have continued to do well, and we want to continue working with them to move them forward. Today, we take another important step for a very important part of the state of Florida. Some of our absolute best economic engines are in communities throughout South Florida. And so we have been consulting with Mayor Jimenez here in Miami-Dade, Mayor Dale Holness in Broward, the administrators in both counties, and other local officials to plot a way forward. And so today I'll be signing, or I have signed, an executive order that grants the requests from both Miami-Dade and Broward to move them into phase one of the reopening for the state of Florida. Now, we did, when I announced phase one, we followed the White House guidelines, but we didn't even do everything that they said you could do in phase one. So it was kind of a limited phase one. It was a safe step. It was a smart step, but it was done step by step because we think that's the best way to build confidence. And so Miami and Broward will be in a similar vein with that. And part of the reason why I think that this makes sense is because they've progressed nicely in terms of dealing with the epidemic. If you look at the case numbers and the percentage of new individuals testing positive in Miami-Dade, it's far below in the last 10 days what it was in the beginning of April, where they were having over 500 cases a day. If you look, actually, the cases yesterday was the only time it's been above 250, I think, since May 4th, but that was because we've had the outbreak at Homestead Correctional Institute. So you've had over 100 cases from a prison, which is obviously an issue, but it's not really reflective of cases in the community. And likewise, Miami's percent positive test results have gone down significantly. In fact, have been under 10% every day in the last 2 weeks, except for yesterday, which was, of course, driven by the prison outbreak. ICU 2 weeks ago in Miami, on 4/29, Miami-Dade had 197 patients, COVID patients in the ICU. As of last night, it was 126. That's a 36% decrease in COVID-positive ICU patients. Ventilators, 120 patients on ventilators on April 29th. Last night, 68 patients COVID-positive on ventilators. That's a 43% decrease. So the trends have been positive, the work has been effective, and so moving Miami-Dade to phase one complies with the criteria that were set out by the White House, but also is the sensible thing to do given the progress that's been made. And I think the story is similar in Broward County. Influenza and COVID-like illnesses have both been on a downward trajectory really since March. The percent positive of new cases has steadily declined. It was 7.7% on April 29th for new cases. On May 12th, it was 4.4%. There was a time when Broward was testing 15, 16%, were coming back positive. They're now, even all the tests from the whole time are now under 10%. So that's a really good trend. The ICU 2 weeks ago to today, 44% decrease in ICU patients in Broward County. Ventilator patients 2 weeks ago versus today, a 56% decrease in Broward County. So I think the data and the facts are very clear that Southeast Florida, even though they had to face the most significant epidemic in the state of Florida, they flattened the curve. Their hospitals were never overwhelmed. In fact, they had a lot of space throughout most of this period, and they are ready to move to phase one. Now, Dade and Broward both submitted plans that I've approved. They're not going to have identical approaches in every respect. And I think that makes sense because even though we can look at Southeast Florida from the vantage point of other parts of Florida as being kind of a unique region, everyone who's down here knows there's a big difference between Broward and Miami-Dade. They're very diverse places. And so they're not going to have the exact same approach on everything, but they are collaborating and coordinating on key issues that will affect both counties and will affect the Southeast region. So I think that is the appropriate approach. And from the very beginning, we've worked collaboratively with both counties. I remember when all this started, I was talking with Mayor Jimenez about how we needed to protect senior citizens. So we did things in Florida like ban hospitals from sending COVID-positive patients back to nursing homes, which other states required, and that led to massive outbreaks and unfortunately thousands of deaths. How important it was, and so he acted very quickly because these senior centers are very popular in Miami-Dade, and he acted to protect that. And I think that has saved a lot of lives through his actions. I also work with Mayor Holness when we were analyzing this in January and February. Kind of the federal health experts were telling us that, well, we don't think it has a presence in the U.S. It's coming from China. I think we now know that it went from China to a bunch of places around the world and ended up coming to America. But as we were testing folks, you'd see people come in, test from foreign country, whatever. we had a lot of negative tests. We started to get some from international travel, but then it was really Broward where we started to see cases popping up around the cruise liners. We work with the mayor. What do you guys need? We set up this big National Guard test center, which has been probably the most successful test center in Florida, maybe even in the country, because I have National Guard leaders come to watch how that is done, and that was a partnership with local government and the Memorial Healthcare in the state of Florida. So we've been having to work, and these counties have faced a lot of challenges. When you have one of the biggest events in the world, the second week of February, the Super Bowl, the opportunity for that to start spreading through the community. When you have all these cruise ships coming in, all these flights from New York going to Fort Lauderdale, these were really big challenges, and I think that the approach was very determined, and I think we also understood that the challenges that these Southeast Florida counties face were just qualitatively different than some of the challenges in other parts of Florida. And so it really was a bottom-up approach. It was tailored to the local circumstances. And I think that because of the determination, we're now here able to take this first small but very important step for this region. The final thing I'll say before I introduce my friend Mayor Jimenez is, what we're seeing in the data, if you look throughout the state of Florida, in particular outside of Southeast Florida, as we see new cases pop up in amounts that are anything more than a trickle, we can tend to pinpoint it almost every time at this point. Sometimes it represents a prison outbreak, and so if you see 50 cases in a rural county in North Florida, probably a prison, because they have a lot of prisons up there. Sometimes it'll be a data dump where a hospital will have a lot of backlog tests and then put them out in one county, and then you can figure that out. Sometimes when we introduce new test sites, you'll see a short-term blip, and then it really kind of crashes down after that. But probably the most significant source in terms of clinical consequences of new cases are cases that occur in long-term care facilities. And so we have done a lot in the state of Florida, both in terms of on the front end and then now with testing to be able to go on offense to protect long-term care facilities. But this requires a whole of Florida approach. We need the local communities to be engaged, the county governments, county health departments, hospital systems, because if you can prevent outbreaks in these nursing homes, you are going to dramatically lower the death rate here in the state of Florida and elsewhere. And so I think the tip of the spear going forward is going to continue to be these long-term care facilities. If it gets in one facility and starts to spread unnoticed, it can do a lot of damage. We're working on a bunch of other solutions in terms of how to properly isolate some of these patients. A lot of them are going to the hospital now, even though they really just need individual convalescence. So we're working on a lot of different things. But I would just implore communities throughout Florida, understand what facilities you have in your jurisdiction, understand what some needs may be. We in the state of Florida have sent out 10 million masks just to long-term care facilities, 500,000 face shields, gloves, all this stuff. We have a mobile lab going around all the long-term care doing rapid tests. We have 50 National Guard units testing. So we've put our money where our mouth is. We need to make sure all the workers at long-term care facilities are on a periodic basis availing themselves of the testing resources that are available in the state of Florida. So if you're working at a long-term care facility in Miami-Dade, you should be going on a regular basis to the Marlins test site or our Hard Rock test site or some of the other test sites that are available. Obviously, you can go to your medical provider, because if we can keep it out of those facilities, we're going to be able to save a lot of lives. So I think that as we open up the economy and take safe, smart approach to doing that, that's not going to happen overnight. It's going to take time. But we can't take our eye off the ball. The virus is still here. It doesn't seem to be generating as many cases in Southeast Florida as it was doing 6 weeks ago. But in those enclosed environments still represents a significant threat. I've talked to both mayors about it. They're very much engaged. They understand. And I think we just have to have all communities in Florida have an all hands on deck approach to this. And so with that, I'm going to allow our Miami-Dade County Mayor, Carlos Jimenez, to say a few things about his approach, and then we'll have the Mayor of Broward County, Dale Holness, say some things about the approach of Broward County.
Thank you, Governor, and again, thank you for your leadership. It's been a pleasure working with you. It really has, and your leadership here in the state of Florida, you know, the results speak for themselves, and thank you so much. I want to thank Broward County and Mayor Dale Holness for collaborating with us, and also Broward County Administrator Bertha Henry. Thank you for being here, and we've really had a very good working relationship between the two counties during this entire pandemic. With us today also are Commissioner Steve Bovo and Commissioner Pepe Diaz from Miami-Dade County, and Mayor J.C. Bermudez from the city of Doral. I want to thank, we're here to discuss phase one for the reopening of non-essential businesses in our county. Yesterday I sent the governor our final draft of Miami-Dade's 182-page new normal guidebook. It offers detailed steps on how we will be moving to a new normal in our local economy. The governor and his administration have done an outstanding job in reviewing this guidebook in record time. Thank you, Governor. And thank you for your fast-tracking that effort and making sure everything aligns with the high standards that you have set for our state. I'll also be remiss in not recognizing our Lieutenant Governor, Jeanette Nunez. Again, it's been a pleasure working with you. Thank you so much. On Monday, May 18th, certain specific non-essential businesses that were closed by executive order due to the COVID-19 will begin to reopen here in Miami-Dade. The discipline of our residents, and I really have to express my gratitude to the people of Miami-Dade County and their discipline. It's really because of you we're able to take this step. And the expertise of our local and state health leaders have helped us flatten the curve on the coronavirus in our county. We're now ready to start reviving our economy. Our new normal guide sets very specific safety rules and capacity limits for a wide range of businesses that will be allowed to reopen. This guide was developed in close consultation with medical and industry experts and government partners, including Governor DeSantis, the Florida Department of Health, doctors and epidemiologists at Jackson Health System, UHealth, and the medical schools at FIU and University of Miami. We have also worked diligently with the Miami-Dade County League of Cities. We've been holding virtual meetings 3 times a week for the past 2 months to iron out strategies and communications so there's consistency in our efforts, even when some municipalities have had to put more stringent rules in place due to their enforcement capabilities or maybe some budget restraints. I want to thank Doral Mayor Juan Carlos Bermudez for participating in all these meetings with the League of Cities. Miami-Dade County's new normal guide includes a clear, color-coded system for letting everyone know the level of caution they need to take when going about their daily activities. This system looks a lot like the travel advisories that we have all come to trust and rely on since 9/11, with a couple of added layers of security precautions. At the height of our COVID shutdown, we were in the red zone, with only the most essential businesses allowed to remain open. On April 29th, we eased up a bit, letting people return to the healthy open spaces of our parks and marinas and golf courses. This new orange phase of our recovery helped everyone get fresh air, exercise, and sunshine while maintaining strict social distancing and wearing masks when needed. On Monday, we will be ready to advance to the yellow stage of our new normal. This will include the limited openings of non-essential businesses and facilities such as restaurants, warehouses, manufacturing, office buildings, and a specific list of small businesses. I want to make it abundantly clear that we're not talking about opening all businesses yet. On Monday, we will not be opening spas, bars, gyms, and unfortunately back there are beaches. We will not be opening movie theaters, bowling alleys, pools, tattoo shops, or massage parlors. On Monday, however, we will be opening up many other businesses. We made the draft of our guide available yesterday because each business and its customers will need to fully understand the rules for our new normal. You can find all of the details online at miamidade.gov/newnormal. We will have a dashboard there that makes it easier to sort through all the information. For the general public, the new normal rules at non-essential businesses look very similar to what we've been doing when you go out in the past, for the past 2 months to pick up your groceries or medicines at a pharmacy. At these and other businesses we will be reopening, you will still need to practice social distancing of at least 6 feet, wear face coverings on your mouth and nose when indoors, wash your hands frequently. You must take personal responsibility and follow the rules. Everyone must assume that they are asymptomatic carriers of the virus and could be passing it on to other people without even knowing about it. Also, please remember at the time, don't touch your eyes, nose, or mouth. As for business, the protocols are now more extensively outlined of each type of industry. The new rules continue to include clearly marking the spacing required between customers, frequently cleaning all high-touch surfaces, providing hand sanitizers, and a whole list of other requirements specific to each type of business. Owners and employees need to carefully review the rules for their particular business at miami-dade.gov/new normal. We look forward to bringing our businesses back to life and getting our residents working again. And as we do this, our discipline and self-restraint will be the keys to our success. Miami-Dade County will follow the science of our health experts every step along the way, and every step along the way to our economic recovery. We will continue to expand testing. We will be more fully institute contact tracing to avoid the development of any new COVID hotspots, and we'll shut down any businesses that don't comply with the new rules and our new normal. If we see an increase in COVID patients in our hospitals or any other a rise in key indicators that we are tracking daily, we will move out of yellow and back into an orange or a red zone, depending on the situation. It's going to take the full teamwork of everyone in our county to make sure that this new normal works. So remember, I keep you safe, you keep me safe. It's not just a motto for others to live by. It's something that we must all practice daily to ensure the health and security of everyone in our community. One final reminder, when you aren't going to work or heading out to a specific purpose at the businesses that will be opening up on Monday, it is still always better and always safer that you're safer at home. And now also I want to talk a little bit about what the governor said about where our battle now lies. It does lie in those long-term care centers. And Governor, we're committed to taking this battle on and protecting those that are most at risk in our county and our community. Now, Mayor Holness will now speak, and then Mayor Bermudez will speak, and then after that, I'll come back with some comments in Spanish. And so, Mayor Holness from Broward County.
Thank you very much, Mayor Jimenez. Let me start by saying thank you to the governor, Governor DeSantis. Thank you and your team for being accessible, responsive, and supportive of what we do in Broward County. We're truly grateful. We're benefiting from that effort, the collaborative effort that we've had. And also to you, Mayor Jimenez, the conversation that we have on a regular basis, especially with you and our county administrator, to get us where we are. And we are a region. The South Florida region is one community. We are in this together. And we must work in a collaborative manner as we go forward to beat this COVID-19 virus. I want to also thank our county administrator, Bertha Henry, who's worked tirelessly, hardly ever getting much sleep. To you and your team, I thank you for the work that is being done to get us here. And our mayors, the mayors of Broward County have been quite supportive. At the onset of this, we were somewhat not together. But I can tell you over time, we realized the importance of the entire community working together to ensure that we're beating this COVID-19 virus. So we've been on calls on a regular basis, and their consensus is that we do open on Monday the 18th, so that we can act uniformly across Broward County. Mayor Jimenez has covered a lot of the things that is in our plan also. It tracks pretty similarly, but not exactly. For example, we're going to allow homeowners association and apartment complexes to have their gyms open, but in a limited way with, again, the caution that we have utilized over time to get us to where we are. On the issue of beaches, the consensus from our mayors on our call yesterday was that we wait until at least the 26th before we do any opening of the beaches. And in our conversation with Mayor Jimenez, we agree that it's best that we do it together as a region. If we open one section of the beach or one city and the others are not open, then we'll have the crowd and get back to where we were, not where we want to be. So our conversation will continue, that we work together across boundaries, and really people don't see one anyway. Most people don't know that there's a difference between Miami and Broward County, because there's no line that you cross over. There's no checkpoints. If someone get ill in Miami, it will come to Broward with this COVID-19. It doesn't know any boundaries. So we must continue to work together in order to ensure that we continue this downward spiral that we have seen. At one point, we were up to 242 tests positive in a day in Broward County. We're able to get down to as low as 21 in the last couple of days. So we are definitely on the right track, on the right pathway to get to where we need to go, so we can get back to where we can work together to bring prosperity to all the people of South Florida. It's going to be a long, hard haul for us to revive the economy to where we were before, with a 2.6% unemployment rate in Broward County. But again, we're going to have to do this together across any lines that there might be, whether it be the county of Dade, Miami-Dade, or Palm Beach. We are one region, and we'll benefit from working together as one community. I think Mayor Bermudez would like to say a couple of words on behalf of the collaborative effort amongst our cities.
Thank you very much, Mayor. First of all, let me welcome everybody here to downtown Doral. Thank you to the Codina family, the Codina group, for the opportunity to be here today and give us this opportunity. I want to welcome you, Governor, back to the city of Doral, and Lieutenant Governor, who's been here before on many occasions. We welcome you to our community. I want to thank the county commissioners that are here, including our own county commissioner, Pepe Diaz, Steve Bovo, Representative Ana Maria Rodriguez, State Senator Manny Diaz, who both represent our area. And I want to thank Mayor Carlos Jimenez because, as was mentioned before, he has kept our municipalities through the Miami-Dade County League of Cities involved from sometimes too many Zoom meetings, I think. And the most important thing I want to stress is these meetings always included individuals who are experts in the medical field. Here in Doral, we're very lucky to have today the largest downtown on the west side of Miami-Dade County. But more importantly, we have over 12,000 businesses. We also are the headquarters for Miami-Dade County Police, Miami-Dade County Fire, Miami-Dade County Elections, and the United States Southern Command. So for us, it's very important to make sure that as we go through the new normal, we actually do it the right way. And what we're very excited about and positive about, and I believe you me, I know some of you are business owners, I see you here. I received your calls. I'm sure Mayor Jimenez also received them. We understand that we need to go forward to the new normal, but we're going to do it the right way and the safe way. And that's very important. In Doral, we've had only one new case in the last 9 days, which is similar to the trends we've seen across the county. And most importantly of all, beyond the trend going down, we also understand that now is the time to move forward in the right direction with a new normal. But I stress again to my business owners, to our residents, and I want to reiterate what Mayor Jimenez said, this would not be possible if our residents and our business owners did not do what we asked them to do. But I would like to stress once again that we need to do it in a safe way. And we as municipalities, the county and the state are committed to that. So thank you. And we're not going to be in the normal yet, but we are going into the new normal. Mayor?
Thank you very much, Mayor Bermudez. Muchas gracias al alcalde Bermudez. Buenas tardes a todos y gracias al gobernador Ron DeSantis, la vicegobernadora Janet Núñez por estar aquí con nosotros. Le tengo que agradecer el liderazgo del gobernador y la vicegobernadora durante todo este tiempo. Ha sido un placer trabajar con ustedes. También quiero darle las gracias al condado de Broward y su alcalde Dale Holness por colaborar con nosotros. El alcalde J.C. Bermudez todos los días hablando con usted en Zoom. El condado de Miami-Dade está listo para revivir su economía. Estamos aquí para hablar de la primera fase de la reapertura de nuestros negocios el lunes 18 de mayo. Ayer publicamos un guía que los comerciantes se preparen para las nuevas precauciones que serán necesarias para abrir. Le quiero dar las gracias al gobernador DeSantis otra vez y su oficina por haber revisado este documento en tiempo récord. Esta guía asegura que la apertura de nuestros negocios en esta primera fase sigue las recomendaciones de los expertos médicos para proteger la salud de los trabajadores y los clientes. Gracias a los residentes que siguieron las órdenes de emergencia y a los expertos médicos que nos guiaron. Hemos logrado aplanar la curva de casos. Por eso planeamos abrir ciertos negocios no esenciales que tuvimos que cerrar por órdenes de emergencia del COVID-19. Esta apertura tiene que seguir las medidas en esta guía de nueva normal, la New Normal. Hemos trabajado en conjunto con la Liga de Ciudades de Miami, haciendo reuniones 3 veces por semana durante los últimos 2 meses. De esta manera tenemos un plan consistente, aunque hay ciudades que pueden mantener restricciones más estrictas en lugar. Le doy las gracias al alcalde otra vez de Doral, J.C. Bermúdez, por participar en todas las reuniones de la Liga de las Ciudades. La guía se basa en una lista de colores que marcan cada fase. La fase más severa de la crisis fue asignada el color rojo. Solo los negocios esenciales podían estar abiertos en esa fase. Ahora que los parques y espacios públicos se abrieron el 29 de abril, con restricciones, estamos en la naranja. El lunes vamos a movernos hacia la fase amarilla de la nueva normalidad. Esto incluye la apertura de restaurantes, almacenes, edificios de oficinas, barberías, peluquerías y una lista de negocios pequeños. Quiero que se quede claro, no estamos abriendo todos los negocios todavía. Los spas, bares, gimnasios y playas no van a abrir este lunes. Tampoco pueden abrir los cines, piscinas, tiendas de tatuajes y masajes. El documento completo con todos los detalles se puede encontrar en miamidade.gov/New Normal. Para el público, las reglas serán las mismas que les has guiado hasta ahora. Mantengan la distancia social, usen máscaras adentro de estos comercios, lávase las manos frecuentemente, tome responsabilidad y siga actuando como si todos tuviéramos la infección. Recuerden, muchas personas tienen el virus sin tener ningunos síntomas. Les pido a los comerciantes y los empleados que revisen este documento para que estén seguros de las reglas que deben seguir. Estamos ansiosos para que las personas puedan volver a trabajar, pero lo más importante es prevenir el contagio de este coronavirus. Si vemos que las reglas no están teniendo efecto y vemos que las personas con el COVID-19 aumentan en los hospitales, tendremos que volver a la fase naranja. Esto significa que los negocios volverán a cerrar. Si todos actuamos con responsabilidad, podemos evitar tener que volver a esa fase. Gracias y que Dios lo bendiga a todos.
All right. Why don't you let Jeanette go?
Good afternoon. Thank you all for being here. I want to thank the governor for his steady hand during this crisis. I want to thank the mayors who have also been tremendous partners, all the elected officials that have joined us here today. We appreciate Floridians, the sacrifices that they've had to make. We understand that as we now go into, for the 2 counties, Miami-Dade and Broward, into phase 1, that they also are going to have to take individual precautions. But we thank these mayors because this has been a tremendous trial that we've had to see. I've often said we've been dealing with 2 crises, one of public health and one of the economy. And so we know businesses are struggling. We see here in downtown Doral all the wonderful businesses that have sustained this economy in Miami-Dade and for Florida. And so we're eager to see people to get back to work. And we're eager to see people to resume their daily lives. But as the governor has often said, we have to do it smartly, we have to do it safely, and we have to do it step by step. And together, we know that we will be able to overcome this coronavirus, and we will be able to get back to the prosperity that Governor DeSantis was headlining under his leadership. Thank you all so much.
I want to thank everybody. I know some people have been asking about the test sites we've been running. Those continue. So Hard Rock, you have Marlin Stadium. We have the hybrid drive-through walk-up in Miami Beach at the Convention Center. That's going to continue. Our Broward sites are going to continue the walk-up and drive-through. We've actually added sites throughout the state as we've gone into phase 1 in other parts of the state that didn't necessarily have as significant of an epidemic. So we want to continue to do that. And then we are going to continue, obviously, to have these National Guard teams going to the nursing homes and long-term care facilities. And this mobile lab is going to run every day, rapid testing into the future. Also, an update on reemployment assistance. As of last night, the state of Florida has now paid out $1.8 billion since the pandemic hit. Since Monday morning, there have been 53,575 new unique claimants that have been processed and paid, and there were 356,776 payments made just this week alone, and we're obviously going to have more going on this weekend. So let me just say that I really believe in South Florida's future. I think this has been an incredible engine for the state, particularly when we were here for the Super Bowl. You look, unemployment so low statewide, people coming down to invest in Miami, people coming down to invest in places like Fort Lauderdale. We're going to get back there. We need to get back there. We need South Florida to help lead the way. So I believe that this is a small step, but it's not the final step. And we're going to get back, get our mojo back, and be back to where we need to be. And the final thing I'll just say to people is, you have all this stuff with the mitigation efforts, and the news reports you see are people, how many cases, how many this, and obviously that's important information. But there are a lot of millions and millions of Floridians who never even know anyone who is necessarily affected by coronavirus, but they sure have been affected by some of these mitigation efforts. You have students who weren't able to graduate from high school, people who missed a senior prom. You've had weddings and other family gatherings have to get canceled. So this has been a very, very trying time, and a lot of those folks people need to understand those folks have faced a lot as well. And so as we get back, we need to make sure we're back to where people can do those things again, people can live life to the fullest, and that's the goal that we're all shooting for. So with that, I'm happy to take some questions.
Coming up.
Yeah, I think we're going to put out tomorrow. I'm going to be in Jacksonville putting out kind of our next steps. The phase one that we did not include all the phase one that could have been done under the guidelines. So we're going to make an announcement on that tomorrow, but suffice it to say what they're proposing will be authorized starting Monday. So what I would say to that is it's important for the staff to avail themselves of those resources. So any ALF in Miami-Dade or Broward, send your staff to these facilities. We have always, from the beginning of it, had a dedicated line for healthcare workers, and obviously those workers are probably the most important, because if you work at a hospital, you're likely going to get tested at a hospital now. You won't even need to go through it. So I would say send them there every 2 weeks. Run them through, and it should just be a matter of course. We have the tests available to do it. We will provide the tests if we need to. Well, we are sending people in, but I think you may know there's over 4,000 facilities in the state of Florida. So we have National Guard strike teams. The mayor is going to work with hospitals, both mayors. I know we want hospitals to be able to go in. I just spoke this morning with the White House. They're going to send some of Admiral Girard's folks down, and then we're also working with some private providers to be able to do it. The issue is, and then we also have some tests now, some of these mouth tests, I guess it's saliva, where those can potentially be administered by the workers there to the residents and the other workers. So I think you're seeing us really push hard to expand the menus of options, but I would just say we're sending people to facilities. But we've tended to go where there was the most acute need. We have thousands of facilities in Florida that have not had a single infection during this time period. That's unbelievable. I can guarantee you look at like New Jersey, some of these places, they've had a much tougher go. So they have done a great job here in Florida. But yes, make sure the staff is getting tested We have the sites available. You will go right through. You'll be a priority, and we want to continue to do that. So we're going to actually be unveiling kind of our next step plan on this. Department of Health, I asked them to do this last week, so they're finalizing that. But I told them surge resources. In fact, a lot of the resources we have now were me already taking resources in other places and putting them in the ALS. I was doing this weeks ago when nobody was really talking about it, but it was clear that that's where really the most vulnerabilities lied. Yep. So I just signed something today till June 2nd, extended June 2nd. Foreclosures and evictions. Yep. I'll announce that tomorrow. I know that's something that's probably near and dear to your heart. So stay tuned on that. Look, you had certain guidelines that CDC put out, and they think that gyms were like a problem, so that's why they were closed. I think if you do sanitation, first of all, this is a virus that if you're in good shape, you're probably going to be okay. So why would we want to dissuade people from going to be in shape? So we're going to have an announcement on that tomorrow, but I think it's really important that people have access to gym and to different exercise. The data on this is overwhelming. If you look in some of these jurisdictions, any under 65, it's like 90+% of the folks under 65 that have had fatalities have had serious conditions, and many of that has been tied to obesity. So let's tell people to get out, do those things. That's one of the reasons why I always promoted outdoor activity. A lot of people said, oh my gosh, how could you have people golf or do this or do that? The fact of the matter is, outdoors is our friend. Getting out and doing things there, the transmission is much more efficient in enclosed environments. So Florida has nice weather. We should take advantage of that. We've had golf courses running outside of Southeast Florida the whole time. The Villages, the retirement community in Central Florida, they had like record tee sheets, and there's 0 people from the Villages in that UF hospital in the Villages right now. So clearly you can be active and be safe. There's no problem doing that. But we're going to have an announcement tomorrow that's going to encompass the gyms. Yeah, so the question was, what about, how do you go from kind of phase 1 to phase 2? If you look at it, the different stuff, the phase 2 really isn't that much different than what Florida's done already, just in the sense of we never closed daycares. We had them open throughout the whole time. I'm not aware of a single outbreak emanating from a daycare, from a child infecting a parent, and we had them open the whole time. So the child care and the child activities, we think that that those need to go anyways. And then really it's basically about opening up bars and some of those things. So we'll obviously look at it, but I think the main thing is keep going in a good direction, keep building on success, and then we'll have a good pathway forward. What? So if we're not going to go back, in this, I've been a broken record on this from the beginning. I was criticized, but it was the absolute right approach. We have a diverse state. The epidemic that Carlos dealt with is way different than the epidemic that Mayor Curry dealt with in Jacksonville, or that people dealt with in Pasco or the Panhandle. So I'm not going to be sitting here rolling back the entire state if there's an outbreak in, say, Hialeah or something. So these are going to be local things, and they're going to be having to look and deal with that. But the state of Florida, we have so many places where the caseload is so low, and really outside of prisons and nursing homes, we're seeing very few cases. I don't know what the Florida Chamber is saying. I mean, I go by the beat of my own drummer. I'm not singing their tune or anybody else's tune. I haven't had any discussions about phase 2, but again, if you look at it, if you actually read those phases, we started, Florida's April was way above where any of these other states were, even on their phase 1. So just understand, we're starting from a much higher baseline. I kept construction going. Actually, we're accelerating road projects here in Miami. I got I-4 Ultimate. We're going to have, I think on Monday, we're going to have a nice unveiling of these great new interchanges. We accelerated projects by months and saved huge, I think we saved, money doing it too, which is important, but that's going to reduce traffic. So we started here. Some of these other places are here, and that's the way it's going to be. So if the economy is functioning and we have job opportunities, then obviously you should have to look for a job before you get unemployment. We waived that just because it was a situation where the economy, basically there was a national shutdown, so a lot of this stuff was stopping. But that'll be dependent on how things pick up. I do think that there is some pent-up demand. I think people want to get out there. Obviously they want to be safe, but I think we've shown that that's going to happen. And a lot of the big companies, Disney, they furloughed like 75,000 people. But I think they're going to bring them all back. At least that's my hope, to be able to do that. So I would love to have an economy where people are hiring, and then obviously you're required to look for a job. If no one's hiring and businesses aren't open, then it's not realistic to ask someone. So that's why I waived that. All right, we're going to go. I got to go over to Collier County. I think the mayors can stay and answer some more questions, but we are going to, we got some fires over there. Maybe it rained, so hopefully, but we'll have a good announcement tomorrow as well for next steps for the rest of the state.
Yes. Yeah. Can't hear you with this. Yes. Right now, when he's indicated that he's going